my child needs a crown on a baby tooth? What are you talking about, Dr. Olga? Crown? I'm Dr. Olga Dolghier, Palm Valley Pediatric Dentistry. I'm a board-certified pediatric dentist. And yes, sometimes we have to do crowns on your child's permanent or even primary teeth. Primary teeth are more common because that's pediatrics. Today, I want to address this. We go by certain guidelines. Every pediatric dentist in the country should and do. What we do if we have a big cavity, if your child has cavity on multiple surfaces of their teeth, back teeth or front teeth, fillings do not last the lifetime of the tooth. We want the tooth and the work we do on the tooth to last until that tooth comes out naturally, exfoliates and grow adult tooth in. To achieve that, sometimes we have to do crowns. I want to show you what kind of crowns we have available. There's multiple ways. The most traditional ones, and which I like the most, is your stainless steel crown. Simple, easy. It has some pros and cons. What I like about this crown, that it requires minimal tooth reduction. I just barely prep that tooth, remove the cavity, and I can snap it right on. Sometimes I don't have to numb your child. The cons is that it is gray color. So even if we're doing it in the back, when your child smiles and we're doing first molar, which is next to your canine tooth here, it does show, and when your child smiles, you will see them on pictures. Kids love them. They call them Iron Man tooth. They call them a princess tooth. So if we don't put appearance negative annotation on the color, your kid would not know the difference, because most of the kids in the United States have gray crowns. That's normal, that's protective, lasts the lifetime of the tooth, comes out when adult tooth grow in together with the baby tooth, and does not need any follow-up treatment. Well, we live in an aesthetic society. Now we have more and more requests from parents, not from children, about white crowns. Moms and dads want the aesthetic. They want to look for beautiful white smiles. Even child does have a big cavity. So the alternative treatment is zirconia crowns. Zirconia crowns cover the entire tooth structure. Pros and cons. Pros, that aesthetically it's beautiful. It looks like your natural tooth. When we take picture, it fits great. It looks amazing. Looks, aesthetics is the pro. Negative things. I have to reduce the baby tooth 2 times more than what I would reduce to make the crown fit. When I have stainless steel crown, I can fit the crown to a tooth. When I have zirconia crown, I have to fit tooth to a crown. That's a big difference. Sometimes if your child had a giant, big cavities in between and teeth already moved together, we lost space, and I cannot fit 2 zirconia crowns together. It's a rare case, but if your child has crowding, I have limitation. I can trim and crimp my stainless steel crown, but white crown, that's it. I have to work around the tooth, make it small to fit it in. So those are big 2 differences. What about front teeth? The front teeth, again, if we have cavities on multiple surfaces, in between, up front, on the back, what we do, we cover them with a crown again. We have 2 types. We have zirconia, again, same pros, beautiful crown. On the front, it does require more tooth reduction, but not as significant as in the back. And it does last until the tooth exfoliates. And the other option is your white facing crown. It's white outside, it looks almost the same. When we filmed this video, our team didn't even see a difference in between. But if we flip the crown back, that has silver, okay? So the silver is on the back side. So if your child flips the head back, you will see that silver. And sometimes they give that light discoloration on the top, which some parents tell me that it looks like gum tissue, looks slightly grayish, not very noticeable. But it does require less tooth reduction. If I have very small tooth left, I still can fit this crown most of the time. Zirconia, I do have limitation with the amount of tooth structure left after decay removal. Those are 2 different types of sets of crowns, which we usually use in pediatric dentistry. Some parents asking an insurance question, is your insurance covered this type of crowns, which which are more commonly covered or not. It depends on your plan, and it depends what type of indications are. Most of the times, both of these type of crowns are covered with insurance, but the price difference can vary. Again, it depends on the contract between the insurance company and you, and your employer in particular. So those are the options. Share with me if your child ever had a crown. Did you have a problem with the crown? Did it pop off? It was a very difficult placement or not? I want to know. If you like this type of videos and you want me to talk more about crowns or other dental products, share with me and let me know. Okay, thank you so much for watching. Dr. Olga for you here.